And I
Yeah.
think that's probably the biggest challenge out there, that a lot of people are moving GLP-1s without guidance. Obviously, at YourEra, we're very intent on helping people get the tools and have success.
Okay, hello and welcome everybody. My name is Gibb Clark. I'm the CEO of YourEra.com, and it is my pleasure to be here today with the Dr. Tom Lavin. And we're really going to cover some great ground today in this episode. But the topic of today's episode is how to get the absolute best results from a GLP-1 based weight loss program, because it really is more holistic, and GLP-1s are really like a foundational piece of that puzzle. But there's so many other things that go into creating a good, holistic, goal-oriented weight loss program, and really just an overall health optimization program.
Right.
So that's what we're going to cover today. And so Dr. Lavin, do you want to kick us off here and really kind of hit on that topic?
Yeah. The first thing, I think the GLP-1s basically hijack thousands of years of evolutionary dysregulation that we have had happen to us. And so it levels the playing field. It allows people to get their weight off by getting rid of the hunger and cravings and food noise and all of these signals that are telling people to eat calorie-dense foods, eat these high sugar foods and ultra-processed foods. So the GLP-1s are kind of the mainstay, because there were a lot of programs before GLP-1s, and they were short-term, ineffective, essentially failures. GLP-1s allow us to win, but it's not just the GLP-1. You have to add a lot more to the programs. And our goal is to optimize people's health and quality of life and ability to live their life at the highest level. And so we'll get into a lot of that in the next 30, 40 minutes to really help patients exceed their expectations with results from these programs.
I love that. It's a great topic, and we're definitely ready to dive in. So, Tom, let's say someone went to YourEra.com and, they filled out their medical intake. They met with their provider. The provider provided them, detailed personalized dosing instructions. Can you walk me through that? Prescription arrives at my door. What else really needs to be accompanying that medication to really find true success?
The first thing is we have a whole clinical team that is positioned for that patient's optimal success with the program. So you have to understand how to take it, which is very simple. There's a little video to show you that. You have to understand that you are in charge. You're a partner with us. So the whole clinical care team wants you to understand how to listen to your body to know that your dose is right at the right point. And once again, learning that the green zone concept might take 5 minutes, but that empowers you with all the knowledge to have the highest success with the GLP-1 program.
You mentioned that green zone concept and really optimizing your medication-based therapy. Can you maybe dive in a little bit to that? What does optimizing GLP-1 therapy really look like?
Absolutely. So with GLP-1s, they're peptides that are extremely effective to take away your hunger and cravings and food noise and level the playing field so you can win this weight loss battle. But you have to understand that your dose is the most important thing, meaning our green zone concept goes from yellow zone, green zone to red zone. And the yellow zone means your dose is too low. You have food noise, hunger, cravings. You're not losing weight. you're not at the optimal dose. You bump the dose, go into the green zone. That's where the food noise goes away. You have this peaceful kind of calm feeling because you're not thinking about food all the time. Hunger and cravings are gone. You fill up on much smaller amounts of food, and you're in the green zone. If your dose is too high, you go into something called the red zone. The red zone's when you have nausea, you feel bad, you're not, you know that you're just kind of sick. That dose needs to come down. So that's the whole green zone concept. And it's up to patients to really monitor that because you can listen to your body better than anybody else can.
No, that's really, really interesting, and I love that visualization of getting in the green zone, because I really feel like it helps patients just simplify what can seem like a complex process. So,
Right.
love to hear that.
I talked to some patients that were, not in our program. They did other online programs and they didn't have guidance. And so they ended up in what we would call the yellow zone where, they didn't have decrease in hunger or cravings. They had food noise. They didn't have guidance on how to succeed. And they'll say, those peptides just don't work for me. And they're wrong, of course, but they don't know they're wrong. So
Yeah.
understanding the green zone concept lets them know that you were just dosed too low. And the same can be on the red zone. There are patients that were dosed too high and nobody adjusted their dosing. And who wants to live nauseated all the time? So they think it didn't work for them. The reality is it's all about dosing. And if you're dosed appropriately, you will have success with GLP-1s.
And that's why, at least from my perspective, it's so important to be able to have available to you that almost like two-way real-time communication with a clinical care team that's actually personalizing the medication to you,
Right,
personalizing your program, and that's absolutely essential to achieve success.
right.
So, Tom, you've mentioned in the past about a medication-based program, but it has to be accompanied by certain things such as strength training and cardio, sleep, lifestyle modification. Obviously, you have the good diet. Maybe can you talk to me a little bit about? You've mentioned strength training in the past, right? Like, what specifically makes a good exercise routine an essential part of a GLP-1 based weight loss program?
There's been so much said about muscle loss and bone demineralization, losing bone strength. And the reality is, um, with any weight loss program, you're going to lose some portion of muscle unless you actually do resistance training or weightlifting. So we are very intent on patients having a weight program where they're in the gym at least 3 days a week doing some kind of resistance training, and that maintains both muscle mass, or you can grow muscle mass while losing weight. Actually, if you're lifting weights, um, and it also maintains your bone density, which is very important, particularly as you get into people in their 50s and 60s, and perimenopausal ladies. So we're very, very intent on those programs. Um, in addition to making sure labs are okay, like vitamin D. Vitamin D is very important for people. So we make sure that we measure lab values so you maintain your vitamin D. We make sure you stay hydrated and educate you as to ultra processed foods versus good, healthy foods. Um, we're in the ultra processed food era. I mean, it's everywhere. So you really have to try to avoid the ultra processed food and eat more natural foods. The other thing is getting enough protein. We really emphasize with your resistance training, weightlifting, you do you get enough protein and creatine. So we recommend that to our patients and try to make sure that they are getting their adequate protein for their exercise program.
Yeah, no, that's really interesting. And you mentioned muscle mass there. Um, what happens to muscle mass as patients achieve a lot of this kind of rapid weight loss? Which again, we're about personalization, and I know you share that mentality as well. But is there a risk of muscle mass loss when you are achieving these weight loss goals quickly early in your program?
Absolutely. If you're losing weight, part of it's going to be fat, part of it's going to be muscle in general. If you're lifting weights, you can minimize the muscle loss and make it mostly or almost all fat loss, which is really the goal. So I really stress weightlifting, resistance training, adequate protein intake, um, and in addition to that, we also recommend um, when people aren't losing weight fast enough, we get them to do the intermittent fasting where they may go 12 to 16 hours overnight with just drinking water, taking coffee. I don't like artificial sweeteners, but stevia, Truvia, or monk fruit,
Yeah.
that is good. So just basically a very healthy change in your lifestyle and approach to food.
Wow. Yeah. No, that makes a lot of sense. One question many of our listeners may have is, what if I haven't lifted a weight in years or ever? Where do I start?
Plenty of people have never, or it's just been a lot of years. So we recommend them getting a personal trainer so they're doing it the right way, or at the very least, just try to do some push ups and sit ups and squats at home. Simple. Start with 5 squats a day, 5 push-ups a day, 5 sit-ups a day, and just start working up. Everybody can do something. So you really just need to start somewhere. And it depends on, do you have a gym that you can go to? Can you do it at home? Do you have a personal trainer at the gym that can help you do lift weights the right way from the start?
Yeah. From the sound of it, what I take away from there is like, no matter how small or how big like the exercise effort is, anything really helps you kind of get started and accompany the program. So we talked a little bit about protein, Tom. How much protein does someone who is in a GLP-1 based weight loss program need to be intaking? Does the math change at all with their protein intake when we're involved in this GLP-1 program?
We base it on your ideal weight,
Okay.
and we recommend somewhere between 50 to 75 additional milligrams of protein in addition to your regular eating, which obviously we recommend um, uh, healthy meats, beans, things that you're going to get good protein from.
Okay. Now that makes a lot of sense to me. So, I've grown up playing sports and working out and being active has just been part of my life. And I've always wondered, even me who's working out, like, is there an ideal window for that protein intake before or after a workout? Do you have any insight on that? Does it even really matter?
The research is all over the place and people have different recommendations. The most important thing is just getting it. People talk about protein before they work out, protein after they work out. I I just feel like you need to get it in during the day in incremental doses, not eat all your protein at one meal because you only have so much ability to absorb protein. So split it up in two or three uh, um, different periods. And I recommend additional protein, meaning get protein that you can mix with, um, either milk if you eat dairy, or almond milk, oat milk, coconut milk, something else, or just water.
Okay, outstanding. So we've talked a little bit about some of the additional items that make it really a holistic weight loss program and a GLP-1 based program. We just covered strength training, exercise routine. Now I kind of want to shift gears to the sleep aspect of this. And sleep health is actually something that is near and dear to my heart. I know it's near and dear to yours because you've been optimizing people's sleep for several years now. So sleep feels like the thing that everyone knows is important, but no
Right.
one really knows how to really optimize or fix that. So maybe how do you connect sleep to a weight loss program and sleep to weight loss in general? And how does that connect? Maybe share a little insight on that.
Well, once again, taking a step back, I'm talking about optimizing your health
Okay.
and your function, health, how you feel every day, and sleep helps everything. It helps your cognitive function, it helps your mood, it helps everything in your body. So, I recommend consistent sleep, meaning you're sleeping going to sleep at the same time every day, waking up at the same time, adequate sleep. Everyone's a little different, but these people that tell me I only need 4 hours a night, they're full of it. I mean, you can't get adequate sleep on 4 hours a night.
That's right.
So we recommend between 7 and 9 hours of in bed sleep. That'll allow you to get enough deep sleep and REM. We also, in addition to being consistent and getting enough, we recommend not eating within 4 to 6 hours of sleep. That's very challenging for people.
Yeah.
I mean, I remember I used to have dinner at 8, 8:30 at night. I
Yeah.
mean, you're embarrassed to eat at 6, but or 5. But now, man, I'm like, I wanna eat earlier in smaller amounts late, um, and then, um, and then have, 4, 5, 6 hours before I go to sleep. Um, Minimize alcohol. We live in New Orleans, so everything is a party. And I like to, you know, go to parties with people, but I try to minimize alcohol even at parties, but particularly during the week, where I can get adequate sleep. Alcohol impacts sleep in a very negative way. The other thing is caffeine. I make sure that I have my coffee in the morning and try not to have any more during the day. Certainly not after 11 or 12 o'clock because caffeine will negatively impact your sleep. Um, and I take natural things like magnesium, glycine, L-theanine, just to help, get better deep and REM sleep during the night.
So, Tom, you talked a little bit about that target quantity of sleep between 7 and 8 hours. What is the minimum someone should be aiming for when in a weight loss program?
Well, I think you need to be in bed at least 7 hours a night,
Okay.
and because it's going to take a while to get to sleep. At the end of the day, it's how much REM and deep sleep do you get during that sleeping period that's going to restore your physical function and cognitive function. So, if you don't get enough REM and deep sleep during the night, you're going to suffer the next day, either physically or cognitively, or both. Obstructive sleep apnea is very tightly tied to obesity. So if you have obstructive sleep apnea, um, yes, you need to lose weight, which is your long-term solution to resolving obstructive sleep apnea. But in the meantime, you should get tested. If your wife says you snore, if you're stopping breathing, you should get tested and put on appropriate therapy, which is really CPAP therapy. I have endless friends that are on CPAP that go nowhere without it because once you get a good night of sleep on a CPAP, your brain is feels great, your body feels great, you have energy, you have clarity. So nobody wants to go without that. And the reason for that is When you have obstructive sleep apnea, you start getting more tired, you relax your muscles in your throat, your airway collapses, so that you have an adrenaline surge, and you don't know this, but you come out of your sleep and you wake up. And once again, you don't know this, but you wake up kind of choking or gasping, and then you start going into the deep sleep again. So you never get into your deep sleep or REM for long periods of time when you have sleep apnea. So your sleep debt is terrible with obstructive
Yeah.
sleep apnea. So, that's something you need to treat it while you have it and work to get rid of sleep apnea, which, weight loss is a key thing to, rid yourself of sleep apnea.
That's really, really interesting, the correlation between weight loss and treating of obstructive sleep apnea. And actually, I think it was back in December of 24, tirzepatide actually became a treatment modality that is now being introduced into the sleep healthcare specialty area, which I think that we are going to start to see some tremendous effects of that. Where the gold standard of CPAP, which has always remained the gold standard, but as a parallel therapy modality in conjunction with CPAP to help people achieve better longer term results.
Right. Yeah. I Traditionally, CPAP was the gold standard, and it is very effective once you get the mask fitted right and on the right pressure and all those things. But today, instead of treating obstructive sleep apnea for the rest of your life, you have an opportunity to lose the weight and resolve the obstructive sleep apnea. So we're doing a lot of parallel therapies today where yes, we do the CPAP so you get good nights of sleep, but at the same time, you're on a GLP-1 program, losing weight, which will ultimately, in high likelihood, get rid of your sleep apnea.
Yeah.
That way you don't have to live with chronic disease.
There we go. Isn't that the goal?
That's the
Preventative
goal.
versus
The
reactionary.
name of the game.
Yep. Okay, so we've hit a couple different components. Strength training, we just hit on sleep. And I want to get into something that you mentioned earlier, which is alcohol and substances while you're in a GLP-1 weight loss program. So let's talk about alcohol, right? People like to drink, like to socialize, and I think I heard you mention you're not seeing really anything wrong with that, but it's limiting the amount of alcohol. So because I know there's a lot of people that might not know exactly where to go or what to do with alcohol within a weight loss program, can you expand on that a little bit more?
Sure. First of all, alcohol, we're trying to create an eyes wide open situation,
Yeah.
meaning we understand alcohol is a part of a lot of people's lives. Try to minimize your alcohol to a point where you don't just naturally go for it every night. And interestingly, what we found because of all the addiction pathways, these mesolimbic and mesocortical pathways that reduce the dopamine spikes or the reward searching, patients don't have that drive for alcohol. So they can look at it and they don't really have the drive to drink. Whereas before the GLP-1s, it was absolutely a drive. Turn on Netflix, open a bottle of wine, drink it, where that goes away with the GLP-1s and these mesolimbic and mesocortical pathway. The mesocortical pathway basically improves your executive functioning over the impulse to do whatever, eat, binge late at night, drink alcohol. So GLP-1s have also had a dramatic impact on the alcohol industry, which is hurting right now because,
Yes, I've heard this.
and, that's a good thing for health.
Wow, that's so interesting to hear you describe like the effects of GLP-1s beyond just core weight loss. from an alcohol perspective, I've heard of things like, naltrexone being introduced, but the GLP-1s is one that I've recently heard come to the forefront. So very, very interesting. Beyond alcohol, are there any other substances, medications, anything else you think would interfere with the GLP-1 as a medication-based therapy, or are they generally no?
Not really. I will say any type of sleeping pill or a sleeping aid that is a sedative, like a benzodiazepine, um, those don't allow you to get adequate sleep. So they're gonna not be consistent with what we're recommending as a program.
Okay. Love that. So we've covered several different aspects. I'll recap them all for the audience, but we've talked about strength and exercise training within a core weight loss program or a GLP-1 weight loss program. We talked about sleep health improvement, the effects of GLP-1s, weight loss on chronic diseases like sleep apnea. We've then talked about alcohol usage and other substances. I want to get into a key topic that you have mentioned at the beginning of the episode and in prior episodes, and that's inflammation and recovery and the effects of GLP-1s on inflammation recovery. So is there anything for our listeners that you can explain or expand on about the effects of GLP-1s on inflammation and recovery?
Well, as a lot of people know, there are a lot of peptides today, and GLP-1s are a peptide that we're looking at for inflammation and recovery. The GLP-1s are peptides that directly impact, chronic body inflammation, and and so in that way, they could help patients recover quicker and just overall be healthier.
Okay. So, how does chronic inflammation interact with weight loss? Is it making the medication less effective or more effective, or the GLP-1s that are having that effect? Is it a compounding effect to lead to better weight loss? Maybe can you expand on that a little bit?
One of the effects of GLP-1s is to reverse chronic inflammation. So they're very helpful in the body to reverse chronic inflammation. Chronic inflammation is bad for everyone. It leads to aging, it leads to organ failure. It leads to all chronic disease, from cardiac disease, from multiple types of cancer, to different types of colitis, to kidney failure, liver failure. So, chronic inflammation is a bad thing to have going on inside your body. And the GLP-1s have a very positive impact in reversing that. When I work with a patient, I really want a partner, with us on the journey. They know their body better than I do, and they're going to be listening to it. So we empower the patients to be partners with us, and starts with weight loss goals that are achievable. And over time, we're going to get them where they want to be from a weight loss standpoint. We're going to try to help them get routine, regular sleep so they're much healthier, they feel better. We're going to make sure that they have some exercise program as far as resistance, and which is which is weight training in some sense to maintain muscle mass and bone density. But I also like the cardiopulmonary side too. So, I tell people, well, get on an elliptical or a treadmill, or just do brisk walking around the neighborhood, something to get your heart rate up a little bit, to get that cardio training. Um, Make sure that they're getting adequate protein and avoiding ultra processed foods, making sure they're staying hydrated. And so those are kind of the main things that we'll focus on as far as a program. The other thing that helps a lot of people is just getting a daily routine with for mental health at the same time. So we recommend, if patients want this, to do meditation and gratitude journaling in the morning. Start your day with fresh um, uh, appreciation for life, who you are, all the things you're thankful for, and also the meditation from my standpoint is just mindfulness meditation where we're trying to teach everyone to be present and live in the moment. It's very hard. Life goes, happens quickly. Everyone's got, emergencies coming in. They've got internet distractions with social media and all of that. But to take a step back and be present, I think is very, very important for everybody.
I love hearing that. It's something I've heard you say in the past, but mindset when trying to achieve any type of goal is so important. So it's great to hear that that's a kind of a core pillar of
Right.
the weight loss program. Um, okay, so you're mentioning really a comprehensive approach to the weight loss programs. Is there a difference between someone who is just on medication based therapy versus medication based therapy combined with this comprehensive type of approach? Have you seen a difference in your practice?
It's important to say that a program without the GLP-1 is going to be a failure, because you're not going to lose weight. If you're already ideal weight, the program's fantastic. That's great. But as far as the GLP-1 helps you achieve your weight loss goals and health goals, everything else is additive and a very important part. And absolutely, patients have much better success. They're much happier. They feel better about life. They have better vitality about themselves. So the program is very important. But once again, the GLP-1s are the thing that came into our world and have changed everything.
If I'm sitting across from you as a brand new GLP-1 weight loss program patient, what does the ideal week look like for me in this new program? Is there anything you can share on that?
It really comes back to the program to make sure that patients understand, yes, you're going to do that shot, which this is a very small needle. People barely feel it. It's very easy for people to do, but you're going to do that once a week. But around that, I really want to wrap the nutrition, the exercise, the weight training, the adequate sleep, the hydration, the avoidance of ultra processed foods, all the things. And you don't have to do everything at once, but over time, we want to add those things so you really get your optimal results and you live your optimal life.
Yeah, and you mentioned a lot of different factors there for a new patient, and anyone that's beginning this weight loss journey or this health goal journey with us, with you under your guidance, and they feel overwhelmed maybe because it's just it's a lot of changes. Is there one thing that you would tell them to focus on first or anything like that? Or
For sure.
okay,
For sure. First and foremost, you want to understand the green zone concept to optimize your dosing to get your best results. Because if you don't understand that, you don't know what to listen for in your body.
yeah,
And once again, they are the CEO of their own health. We're their partners. So that concept has to be, recognized early. Everything about the program we can incorporate over time.
okay. Yeah, no, that makes a lot of sense. One last question on this comprehensive program approach. Are there any common mistakes that you see patients maybe make when they're first getting on medication or just first entering on this health optimization journey?
Yeah, I would say to think that they don't need any help at all.
Yeah.
And I would say a lot of patients need very little help. I mean, they grasp it, they understand everything, and we don't have to do much with them. But other patients need more help to get on track. Once they understand we're their partner. They're the CEO of their own health. They understand the green zone concept and how the program works. It's in their hands, and
They're set up for success.
they're set up for success, and we just work with them to make sure monthly they're on track to get to their goals. And if they drop back in the yellow zone, we bump that dose. The first thing that patients realize when they're in the green zone is the food noise is gone and they don't have their old hunger and cravings. They are the happiest people on the planet. They're like, oh my gosh, they've never had that calmness, quieting of food noise in their brain in their life. And so
it's like a new era for them.
Yes, it is a new era for sure. And once they get that, I said, okay, that's your green zone. Remember that. When it slips away, you're slipping back into the yellow zone. We need to bump you back into the green zone. So once again, that is the first thing patients recognize, and they're so happy. And so once you're able to achieve that quieting of all the food noise, they're very receptive to more of the aspects of the program.
So in your experience, obviously 30 plus years of treating patients, what does long-term success look like? Is this, I've heard terms like forever medication. When should I get off the medication? Is there an off ramp? Is there anything you can share around that?
Absolutely. So, once again, this is not like antibiotics treating, a bacterial infection.
Yeah.
So, and a lot of people today understand peptides. The right peptides can be extremely healthy for a person, and they're not, they can be and likely will be lifetime therapies for people, and there's nothing wrong with that. So, my patients, I recommend, because I've got so many friends and patients, they're calling me all the time, like, what do I need to do? I need to lose, 30 pounds. And I'm like, okay, first, let's focus on the 30. And I said, maybe 50, you say 30, I say 50, so I'm talking about getting them to their optimal weight. So we want to get them to their optimal weight. So we use the GLP-1s as a weight loss tool. And when they get to their optimal weight, I recommend going to a microdosing at that point, because that helps them maintain the weight loss long term, but it also keeps all these other benefits as far as inflammation, Alzheimer's, dementia, protection in the brain, cardio protection, liver and kidney protection, cancer protection. So all those other benefits are gained through the low dosing.
Wow. So what are one or two things that you wish more patients knew before they started this program and this journey?
I wish they knew that if they just take 20 minutes up front to really understand all this, it's going to make everything very easy for them.
Yes.
You're a partner, you're CEO of your own health, and understand the green zone concept. You're doing great, and get a feel for this concept of a program, meaning I'm going to do some resistance training, get my protein, and avoid any muscle or bone loss while I'm losing my weight. One of the things I see all the time is I spent about 22 years doing bariatric surgery.
Oh, wow.
And I had 6 partners. We have literally thousands of patients. We now have those patients on GLP-1s because with bariatric surgery, over time, patients can have weight gain. So the GLP-1s work very well for helping the GLP-1 patient or the bariatric patients reestablish that weight loss that they had in the first several years after bariatric surgery. So it's very important. I have one sweet patient who is a nurse, worked for me in the hospital, and she lost about 200 pounds with
Wow.
bariatric surgery. And then she gained about 40 back. And then she got on GLP-1s and lost all of that weight back.
That
And
is
so,
impressive.
and this is over, probably 20 years now. And so it doesn't matter where you are post bariatric surgery, it doesn't matter where you are in your life. You can start a GLP-1 therapy program at any point, and we're here for you.
So, Tom, we definitely covered a lot of ground today, from a more comprehensive approach to a medication-based weight loss program. How we truly view ourselves as partners with the patients who are coming and trusting you and us with their care. We covered some of these external factors in addition to GLP-1 therapy, such as strength and exercise routine. We talked about sleep improvement, talked a little bit about inflammation and recovery, and then finally that total comprehensive approach. Is there anything that you want to touch on for all of these topics that really kind of tie it all in together?
Really, what my message is, this GLP-1 therapy in a program will work for anyone.
Yeah.
So don't let excuses get in your way. Don't let bad experiences with people that didn't give you guidance. If it didn't work for you, you were on the wrong dosing and you didn't have any guidance. So this GLP-1s will help anyone lose weight,
Yeah.
and achieve their goals if you have the right program helping and the right team helping you achieve that. And understand, once again, that you're a partner and you need to take the time to understand, how this is going to work for you.
If you were to recommend patients all throughout the country to go somewhere where that comprehensive approach is really at the foundation of what we're doing, where would you direct them to go?
Well, obviously, I think there are programs that don't help people. And I
Yeah.
think that's probably the biggest challenge out there, that a lot of people are moving GLP-1s without guidance. Obviously, at YourEra, we're very intent on helping people get the tools and have success.
Yeah. And people can get there by going to YourEra.com.
YourEra.com.
Start their
That's
journey.
right.
So,
All right.
okay.
Great.
Good deal.
All right, Gibb. Great talking to you. It's been a great conversation.
Tom, I really enjoyed the time. It was very, very educational. I feel a lot more intelligent, even from a medical perspective, sitting next to a 30-plus year physician. And just thank you very much for the time. Thank you for having me, and hope we get to do it again soon sometime.
Absolutely.
All right, Tom.
All right.